Hey guys, my name's Elizabeth and I am going to have gastric sleeve surgery on July 10th, and I just wanted to do this video to I don't know, give some education about it, I guess. I researched about it before I decided to do it and looked up YouTube videos on it, so I just wanted to share my story and my side of it. I made the decision to do it back in December. I started researching surgeons in the area, and I met with one in January and got some information about it and decided that the sleeve was going to be the best option for me. I met with a dietitian for 6 months. That was per insurance. My insurance required me to meet with the dietitian for 6 months. I think there's some insurances that require like 3 months, but mine was 6. So I didn't lose a lot of weight doing it because I didn't eat right all the time. I'm on the go a lot, so it was just convenient to stop at a fast food place and eat things that I shouldn't. So I'm kind of doing this to hopefully get my mind right in the process of, of having to eat right. Because of the surgery, obviously I'm not going to have much of a stomach at all. My stomach size is going to shrink dramatically. So drastically, I think that's more the right word. So yeah, a little bit about my story. I was my highest weight last April, I believe, of last year, 2018. I weighed 262 pounds. That was my highest weight. I did a program with Beachbody On Demand and Shakeology, and I lost, within 21 days, I had lost, I think it was 18 pounds and 16 inches overall. I ate really healthy and clean for 21 days, and I worked out. So that worked then, and I just didn't keep up with it, honestly. Life happens, and I just wasn't dedicated, motivated enough to keep going at the time. So yeah, I tried that. I will say that I have PCOS, polycystic ovarian syndrome, and sometimes it can be really difficult to lose weight when diagnosed with that condition. So I'm hoping with having the surgery, basically being forced to lose weight, that will help my diagnosis. I'm 34 years old, and I have a 5-year-old son. I've been married for almost 8 years, and I'm not doing this for anyone but myself, honestly. I have a family history of diabetes, and so far I've not been diagnosed with diabetes, and I hope I never will. But I'm just kind of doing this not to be skinny, because I truly believe that you should love yourself no matter what size that you are. And I love myself being 250 pounds. I weighed myself today and I'm 250. But I'm doing this for one, to prevent having diabetes and or any other condition later on in life. I'm trying to get ahead of all of that and to prevent it if possible. What else should I say? I'm a little bit nervous about doing it. I'm also excited to see where I'll be a year from now. I really just want to be healthy. It's not about being skinny, it's about being healthy. And how I've been the last 10 years of my life since I was, well, actually 13 years. The last 13 years of my life I've been overweight. When I was a teenager, I was about 140, between 140 and 160. And that was a healthy weight for me. I'm 5'8", and in a minute I'll go in front of the mirror and show basically my before picture slash video, because I want to show my progress and to let all my viewers know, you know, what I look like 3 months from now or 6 months from now or a month from now, and just really to track my progress. So, and I'm also creating this video and this channel just so people can ask questions, and if they want to know any information about the gastric sleeve surgery, the doctors gave me this booklet to go by, and it's got pre-op instructions in there, like a pre-op diet, which my pre-op appointment was today. My surgery is scheduled for July 10th, so starting tomorrow, I'm going to be going on pretty much an all liquid diet. I can drink, I like this Premier Protein. It tastes really good. I get it from Costco. It's got 30 grams of protein in it. It's 160 calories and only 1 gram of sugar. So that's kind of, you know, they're allowing me to drink 2 to 3 of these a day. This is vanilla. They have chocolate, which is my favorite. And then they also have a peach one. And I get them from Costco, and I think they're between $20 and $30. I want to say they're like $22 or something. And I forgot how many come in a pack. I think it's 12. But they taste really good. And they meet the requirement for protein, carbs, and the sugars are really low, 1 gram of sugar per 1 serving, which is one of these. Okay, so I can drink 2 to 3 of those a day for the next 2 weeks, as a meal replacement, and then I can have 1 to 2 cups of leafy green salad with like cucumbers and tomatoes, no croutons, because this is a very high protein, low carb diet for 2 weeks. What they really want for the next 2 weeks is to get my liver to shrink. This is for every patient who goes with the gastric sleeve option, to get your liver to shrink, because they will have to lift your liver to access the top portion of your stomach lining. Where was I at? 2 to 3 protein shakes a day, leafy green salad, and then you can have 2 chicken tenders. I would say grilled or baked chicken tenders with like 1 cup of green beans or any kind of steamed vegetables. And you can break it up. She said you don't have to just eat that for dinner. You can drink 1 shake for breakfast, and then you can have like your salad for lunch, and then you can have another shake like 2 or 3 hours later, and then for dinner you could do the 2 chicken tenders and the 1 cup of vegetables. So that's my diet for 2 weeks, and then I'll have my surgery July 10th, and after that I'll have to stay overnight in the hospital for I think 1 day. Right after their surgery, they want you to get up and walk around like I think 5 minutes every hour. They want you to walk around. That's just to prevent blood clots, and to get your circulation going and your strength back up. I think after 1 day they'll release me to go home, and I'll start, I think it's an all liquid diet. I'm pretty sure it is an all liquid diet for the 2nd day after surgery for 2 weeks. Clear liquid diet for 2 weeks. Or that clear liquid is the day of surgery and after surgery, I think. While you're in the hospital for that day, it's clear liquids only. So like water, sugar-free beverages, sugar-free lemonade, Propel, vitamin water, zero, low sodium broth. You can have like sugar-free popsicles. That's the day of surgery. The next day after surgery, it's a full liquid diet. So you have like 3 4-ounce high protein, low fat liquid meals. So your stomach is like it's gonna be super small. My stomach's gonna be super small. It's like, if you can imagine like the salad dressing cups, Tupperware, that's what my stomach will hold after the surgery. So, and you have to learn to sip, like sip everything. Sip your water, sip your protein shakes. And so it's literally going to take me after surgery about an hour to get through one of these. And right now it takes me like 2 minutes. So sip, sip, sip. That's what I have to learn to do. So anyway, 2 weeks after the surgery, it's a full liquid diet. So basically for a month I'm on full liquid diet pretty much. So that's day 2 through 15. Day 16 through 30 is pureed diet, so you can add in soft foods, pureed meats, white flaky fish, eggs or egg substitute. You can have a cheese omelet. That's day 16 through 30. Then day 31 through 45 post-surgery. Pretty much the same thing, but you can have ground or diced chopped meats. So it's more of a it's soft, but it doesn't have to be pureed like baby food anymore. Day 46 and after, you resume a regular diet, but you want to avoid dry meats, high fat fried meats, nuts and seeds. You want to be able to eat moist meats, ground, diced, chopped chicken. It's got to be 93% or greater lean meats. So the range of foods that we're able to eat is more after day 46 of surgery. Yeah, so about a month and a half after surgery is when I can resume eating normally again. I shouldn't say normal, whatever I have to follow the food that's in this this book that they gave me. Also, I'll be on vitamin supplements for the rest of my life. I chose to do chewable, so I have to do 2 chewable in the morning, 2 chewable at night. So a total of 4 a day. Yeah, so I had my pre-op appointment today, where they basically asked me a ton of questions about my medical history. And then they did an EKG on me and took some blood work. And everything came back good so far. So I don't know about the blood work, but I'm sure it did. But anyway, I'm going to be posting videos about my progress. I did mention before that I'm going to show if I can get my camera right, hold on. Show what I look like now. Okay, so sorry. Let's see. So yeah, a lot of this is from having a baby. I have stretch marks here, and this is where I've had skin infections. So hopefully this weight loss journey will help with just making me healthy overall, and that's what I'm looking forward to the most, is just keeping up with that. And I've already started exercising, I guess I could say on a regular basis. I do it like 3 to 4 days a week, so I'm gonna keep doing that and keep you guys posted with everything. So I'll probably do 1 video a month. I'll probably do a video right after surgery if I feel up to it, to let you guys know how I'm feeling, and we'll just go from there. I'm gonna upload this video so I can share it, since I've taken it on my phone. I'm gonna upload it on YouTube on my computer, and if you guys have any questions or comments, just let me know, okay?